A heart attack can happen any time, and often it happens when you're alone. It's a frightening thought, especially for those of us over 60. The pain, the confusion, the panic, and the question, what do I do now? But here's the truth. Knowledge is power, and the more prepared you are, the greater your chances of surviving, recovering, and living fully again. Today, we'll walk you through 7 life-saving tips every senior should know. These are simple steps, many of them easy to remember, but in a moment of crisis, they could be the difference between life and loss. These tips aren't meant to scare you. They're meant to empower you. So take a deep breath, sit back, and let's prepare together. If you or someone you love is over 60, consider subscribing to it Elder Wisdom for you. Here, we offer practical wisdom, health guidance, and gentle support for the years that truly matter most. You're not alone, and you never have to be. Tip 1. Know the silent signs. Heart attacks don't always shout. When we picture a heart attack, most of us imagine sudden crushing chest pain, like in the movies. But in reality, especially for older adults, heart attacks can arrive quietly. Some of the most dangerous symptoms are subtle: unexplained fatigue, shortness of breath without exertion, nausea, lightheadedness, or sweating, discomfort in the neck, jaw, shoulders, or upper back, a sense of anxiety or doom with no clear reason. Some seniors, even those in good shape, ignore these symptoms, chalking them up to just getting old or indigestion. But here's what you must remember. If something feels off, don't ignore it. Your body whispers before it screams. Call emergency services. Don't wait to be sure. It's always better to be safe than silent. Tip 2. Chew, don't swallow. An aspirin immediately. If you think you're having a heart attack, one of the fastest life-saving actions you can take after calling for help is this. Chew a regular 325 milligram aspirin tablet immediately. Why chew? Because chewing gets it into your bloodstream faster than swallowing whole. Aspirin helps prevent blood clots from worsening the blockage in your heart. Keep a small bottle of aspirin by your bedside, in your kitchen, or in your pocket if you live alone. Just remember, aspirin is not a replacement for calling 911. It buys you time. That's all. But sometimes a few minutes is all you need. Tip 3. Call for help. Don't drive yourself. This one might sound obvious, but in the moment of panic, many seniors try to tough it out. Please don't. Do not drive yourself to the hospital, not even if it's close by. Heart attacks can rapidly worsen, and you could lose consciousness while driving, putting others and yourself at even greater risk. The best thing you can do is call 911 or your local emergency line immediately. Trained responders can begin life-saving care the moment they reach you, even before you arrive at the hospital. If you're afraid of being a bother, remember, your life is worth the call. You're not being dramatic. You're being responsible. If you live alone, keep your phone within reach, especially at night or when resting. Set up emergency contact shortcuts, or even better, a medical alert system that can summon help with the press of a button. You deserve the best chance at life, and that means calling first, not last. Tip 4. Stay calm and focused. Panic can make things worse. When your chest is tight and your breathing is shallow, panic feels like a natural response. But panic can increase your heart rate, raise your blood pressure, and worsen the attack. So what can you do? Sit down in a comfortable, upright position. Focus on slow, deep breaths. In through your nose, out through your mouth. Stay as still as possible. Movement increases strain on your heart. If you've called for help, tell yourself out loud, Help is coming. I am doing everything right. This may seem small, but studies show that staying calm can reduce damage and increase your survival chances. Your mind is powerful. Use it to protect your body. If you've made it this far, you're doing something incredible. You're choosing knowledge over fear. If this video is helping, give it a like or share it with someone who might need it. You never know whose life you might save with just one message. Tip 5. Learn the cough CPR myth and why you shouldn't count on it. You may have heard of cough CPR, a method where you cough forcefully to keep blood flowing during a heart attack. But here's the truth. This method is not recommended for the average person. Medical professionals may use a controlled cough in a hospital under specific conditions. But for someone at home, coughing hard during a heart attack can make things worse by putting strain on the heart. What should you do instead? Stay calm. Take an aspirin if appropriate. Call for help. Sit upright and breathe slowly. Don't waste time with unproven techniques you read online. Stick to what doctors and emergency responders recommend. Your best CPR is preparation. Tip 6. Have an emergency plan, even if you think you won't need it. The time to prepare for a heart attack isn't during one. It's before one ever happens. Here's a simple checklist. Keep a list of medications and medical conditions in your wallet or on the fridge. Store emergency contacts in your phone under ICE in case of emergency. Set up speed dial or voice-activated calls on your phone. Let neighbors or friends know you live alone and ask them to check in. Install a medical alert button or smartwatch with emergency functions. Preparing doesn't mean you're inviting danger. It means you're taking care of yourself and giving your loved ones peace of mind, too. Remember, independence doesn't mean doing everything alone. It means being ready. Tip 7. Know what comes after: recovery, support, and hope. Surviving a heart attack is only the beginning. Recovery is just as important, and seniors often recover best with emotional support, routine, and positive thinking. Here's what recovery might look like. Cardiac rehabilitation, a structured program to help your heart grow stronger again. Light movement and exercise, as recommended by your doctor. Support groups, where you can share experiences and gain encouragement. Ongoing medication, diet changes, and medical checkups. But perhaps the most important piece? Hope. A heart attack isn't the end. Many seniors go on to live active, joyful lives after one, especially when they take the time to care, connect, and listen to their body's needs. You are not broken. You are healing. And every day you wake up is another day to be proud of. If this video brought you clarity, comfort, or a sense of calm, please consider subscribing to Elder Wisdom for you. We're here to walk with you through every season of aging, with knowledge, kindness, and community. And if there's someone in your life, parent, partner, or friend, who could benefit from this information, please share this video with them. One share could save a life. You are valued, you are strong, and you are not alone. Thank you for spending time with us. Take care and take heart.